Hi, I'm Stephanie, and I'm a certified personal trainer.
Hi, I'm Kate, and I'm a registered dietitian nutritionist.
And this is a podcast dedicated to educating women on their journey to optimal health. There's so much that we can do to optimize our health, but we've talked to so many women who just simply don't know how.
These conversations are what inspired us to start Omnia Fit. The Omnia Fit podcast is all about interviewing certified professionals to educate women on improving our health. We'll talk about things like stress relief through exercise, what we need to know about our hormones, the truth behind fad diets, and more. So subscribe, follow along, and let us know if there are any topics you want to hear more about.
All right, so how would you describe a physical therapist?
Sure. So a physical therapist is a healthcare professional who works with a variety of injuries, conditions, and diseases alongside typically an interdisciplinary team or sometimes autonomously. So we treat a lot of body injuries, people with post-operative conditions, and then people with degenerative diseases as well. And there's just a huge breadth of conditions that we do see in PT.
You can tell you've been in school for a while because that sounded like a textbook. Perfect answer.
Maybe I've been practicing.
Love it. Because growing up, and I don't know if it's just me, but I feel like I only ever heard of physical therapists from my friends who, like, I'm playing soccer, rugby, or whatever, had ACL tears, get surgery done, then they'd go to a physical therapist. But it sounds like you do so much more than that, obviously. Mm-hmm. Can you kind of explain a little bit more in detail the breadth of what you do and all the different things that you treat?
Of course, and that's something I didn't even know until I was actually in PT school. A lot of people go to PT school wanting to treat sports injuries and just common injuries, kind of like the ones you described. But once you're actually there, you learn about everything we can do. So there's a huge range. From a musculoskeletal perspective, we do see a lot of those post-op conditions, orthopedic, post-ACL, any knee injuries, things like that.
So things like strengthening the muscles to help strengthen the joints, kind of?
Yeah. Preliminary working on, range of movement and then building up the strength, restoring normal function in that way. We can also see people just coming in with an injury, so it doesn't have to be after a surgery. Mm-hmm. And now in a lot of states, we can actually see people without a referral. So we're first contact practitioners in a lot of states. I don't know the actual list of them off the top of my head, but I know in Illinois we can. So people could just come if they have an ache or pain. We can assess that, diagnose, and treat it. And then from a more medical perspective, we're in the hospitals, we can treat neurodegenerative conditions like MS, Parkinson's, just to name a few. We rehab people post-brain injury, stroke, traumatic brain injury to help restore their function as well. We rehab people post-amputations, which is just technically a post-op condition, but it's a little bit different from a general orthopedic or MSK one.
Yeah, losing part of your body that's more than just like a ligament, like your MCL getting taken out or something. Or no, meniscus, not MCL. I'm obviously not a physical therapist. More than just like your meniscus getting taken out, like it's a little different. You need some help learning how to balance and move again.
Absolutely, yeah. There's a whole different set of protocols for that and equipment that you would use as well.
Mm-hmm.
And then beyond that, we also can treat vestibular conditions. So if people present with vertigo or following a concussion, we can help rehab the vestibular system.
Vestibular meaning?
Balance, essentially, equilibrium. Mm-hmm. So a lot of inner ear dysfunction would come with that, or any injury resulting from the brain hitting against the side of the skull, to put it in more of a
like concussions, got in a car accident, or
exactly.
Got hit a little too hard.
Absolutely. And then beyond that, which is very relevant this past year, we can help with pulmonary rehab. So breathing exercises, people with obstructive lung diseases, we help rehab that as well. So obviously with COVID-19 going on, there was a big role in that and a big need for that in the past year. It does go beyond that. There's pediatrics, pregnancy, physical therapy, and all of that has its own little areas of specialization that are different from just walking into an outpatient clinic.
Yeah.
So yeah, there's a lot of specialties, and I don't even know all of them, if I'm being honest.
Going. No, that's awesome. I was expecting like 1, 2, 3, but it's just, I mean, really, the oversimplification kind of sounds like if there's anything going on that's not right with your body, like muscularly or just in terms of movement, whether it's the balance or how the body's functioning and moving and strengthening, anything revolved in that, no matter what was the cause of it, sounds like basically you guys can help with.
Yeah, and we usually work alongside a medical team in more complex cases like that. So we're considered a complementary medicine. Doctors of physical therapy work along with doctors of medicine very often, and then other professions as well, to kind of help tackle those conditions from different aspects. So we're the physical aspect of that.
That's so cool.
Mm-hmm.
My mind's a little blown right now. Like I came in here with I felt like a pretty good knowledge of physical therapy.
Mm-hmm.
I'm finding I'm learning a lot.
Yeah, I love it.
So what do you think? Not what do you think? What do you see most often, or what do people come to physical therapists for most often? Is there even like a one thing above all scenario, or is it just a total range and hard question to answer?
Yeah, it's difficult, but there are some conditions that we see more common than others. So speaking for like a general outpatient MSK clinic.
Meaning like anyone can go up to and say...
Anyone can go up to ache or pain, I was running, I hurt my knee, that kind of thing. That kind of setting that you would walk into. We do see a lot of knee, shoulder, and ankle injuries. The knee can be affected by any weight-bearing activity, so it's pretty commonly injured as far as other joints are concerned, and it's not quite as stable as something like the hip. The shoulder, on the other hand, has the most range of movement out of any joint in the body. With that can come a lot of muscle imbalances and tightnesses, so we do see a lot of shoulder conditions, rotator cuff issues, imbalances that lead to injury, and sometimes it's not always severe where it needs surgery, it just needs a little bit of rehabbing.
Needs a little bit of love.
Yeah, it needs a little bit of love, it always does. And then the ankle's another common one just because it is a weight-bearing joint, and landing forces can play a big role on how we carry the ankle. Of course, you hear a lot about low back pain as well. Anyone working a lot, sitting at a desk, not getting quite as much activity as others might be at risk of injuring their back just to a lack of strength in muscles that would support that in more high impact activities, especially if they're getting into fitness right away for the first time.
So really good to see a physical therapist if you're new to working out. We did a, what's it called? Podcast. That's really embarrassing. I'm probably gonna leave that one in there. We did a podcast for What is a Personal Trainer, kind of helping to educate and help get people started in the right way, staying healthy, making sure they're doing movements properly, proper form. But a physical therapist sounds like can go even beyond that. Of if you're starting to work out and you already have aches and pains, you already have an ankle injury, or that running gives you shin splints, or that your knee can't handle the impact, or especially this last year and a half, you have low back pain and tech neck, I've heard it called, when you're just sitting on Zooms all day long. Your neck's kind of forward, your head's forward, you have a lot of pressure, probably also relating to the shoulders. Sounds like a physical therapist, especially someone like you, does physical therapy and personal training. Great place to start when you're rehabbing from injury and getting started to work out, right?
Yeah, absolutely. So the nice thing about physical therapists becoming first contact practitioners, and what that's kind of working towards, is a more preventative approach to medicine, and being able to schedule an appointment with your PT when you do have such a minor ache and pain that it might not have been a referral. So I am totally with you on that. I think it's actually really important to see someone before you start working out for the first time, especially if you don't really know how to load your muscles properly. Our bodies are built to do a lot of things, but in such a working environment, when we're not actually getting the activity and the strength training that we need to support those movements, we can be injured really easily. So being a trainer myself has taught me so much for physical therapy and vice versa. It's actually the best combination I ever could have given myself in terms of profession. I considered a lot of supplementations for being a PT, but being a trainer is great for periodization, training programs, whatever you are training for, knowing how to program different aspects of that, and that bringing that into physical therapy practice and talking about injuries and prevention just helps create a more comprehensive program for someone. So yeah, I think it's great to speak to someone beforehand just to learn a bit more about that and how you can prevent injury in your own training.
Yeah. I've even had a client where they wanted to start working with me, and I actually put it off because I told them, based on the conversation we had and the consultation I had, I think it'd be better if you met with a physical therapist first, made sure you were cleared from them before we started working out, because there are just so many different aspects of, the trainer had, like you said, we do the periodization and more of the science and planning and exact planning for someone's specific goals, whether it's weight loss or muscle gain or competing for a competition. But if they're coming in with certain, I don't want to say red flags. Does that sound harsh to say red flags?
Red flags are typically more medical.
Yeah.
They would require medical attention for that, but that's something we screen for in PT as well.
Even just like anything that seems a little, getting that exclamation point going off in my head, like,
yeah, of course.
I think there probably needs to be a little bit of rehab done before we jump into even just basic body weight training. So I've actually, even there's been a couple clients that came to me and said, I think it's a little outside of my scope as a personal trainer. Let's have you meet with a physical therapist first. We're going to try giving you a couple people, but you're just capped. So obviously it's a great combination because you're just loaded with clients right now.
Yeah, and I'm totally with you on all of that. I think just the fact that you as a trainer recognize those things to tell me that you go above and beyond for your clients.
Well, thank you.
Yeah, your ability to know where to refer them is such a huge part of your practice. We need that as PTs too. If we think that it's more of a psychological issue that's maybe causing someone's pain, we need to know where to refer them. So yeah, referral is huge. Interdisciplinary teams are huge. I will never trash a personal trainer. I think they are absolutely amazing at what they do, and they're so important. And it's all teamworking really at the end of the day.
So you said you've gotten a lot of clients from physical therapy offices, and then also vice versa, where you refer to each other. So it's really important too, and a question clients can even ask their medical professionals of, just really recognizing that there's a team. It's not just one person saying they can fix everything, saying, oh, there might be multiple steps, but I recommend you see this person and then go off to this person, maybe check back in with me in a month or two, just having that back and forth. Do you see that a lot? Even with because you work for Athletico, right?
Yes.
For advertising, Athletico, physical
therapy.
I was assisting with them. But did you see that when you were working there a lot, the back and forth?
Yeah, there is a lot of back and forth, especially if they do come with a referral. There's a lot of communication between the PT and their physician throughout treatment. And I think where training comes into play is after discharge. It's really good to have a relationship with people who can continue someone's rehab beyond the scope of your practice, beyond when it is clinically necessary to see them, because there is that risk of re-injury after any rehab protocol if someone isn't up to speed and isn't continuing their exercises. So I will always recommend for anyone who it's appropriate for to then start training either under supervision or on their own with a home program. So being a trainer myself, it is nice to be able to say, I'm a trainer, I know some really great trainers if you need someone to refer to or if I have availability. But it's not so much for advertising or getting clients, it's really because there is a need for it. And it's great to be able to recognize that need and refer someone to it.
Yeah, there's no one person can fix all of your problems. There's no jack of all trades in the world of health. And when you have a really good team, they'll refer to each other, and that's one thing I love about where we are and gyms that we work at is just the referral and the connection. I feel like it can be a one-stop shop, but it's because there's like a dozen people that can help you with different things.
I know, I love our team.
Yeah.
We're so great at that too. None of us are too proud, which is really what you need in fields like this.
Yeah, it's awesome. So what made you want to get into physical therapy?
That's a good question. I first heard about PT when I was a patient. I was a dancer in high school. I did point ballet and I had a pretty nasty hamstring strain. So I was referred to PT, and I can't remember the exact thing that made me want to do it, but I remember being in rehab myself and thinking, this is something I could definitely see myself doing. I like working with people, communicating with people, being hands-on, individualizing programs. So when I started to see someone doing that for me, I got really interested in it. And basically, I remember telling my parents, I want to be a physical therapist. All throughout high school, I started taking the anatomy classes just to see if it was something I could handle, if I really wanted to work with the human body that closely. And I did. And when I went to college, I applied with the mindset of going into PT school. There was a little hiccup in college where I was debating between going a little more medical versus PT. And that's just, I think, when you're in a health science program, you start to question your choices and make sure you really want to do that profession.
There's got to be so many routes you can take after you take the basic classes that the basic classes probably help you go into so many different trajectories.
Yeah, exactly. And a lot of PTs are sometimes sort of PA school as well to get a little bit more medical.
Physician assistant.
Yeah. So the about the same amount of grad school, which is why it's so comparable. But but just two different aspects. One's more medical and one's more physical medicine. And I didn't love pharmacology, if I'm being honest with you. I'm not really big on drugs. And I really liked working with my patients for a long time. So when I interned at places, at clinics, I kind of fell in love with it, how long you get to spend with someone, build a relationship with them, and really help them through their whole rehab. So that is ultimately why I ended up choosing PT, which was just great, was the patient experience.
Yeah, that's awesome. Where do you see your career going? Probably still working super closely with, I don't even know like the different routes a physical therapist can take besides just constantly meeting with patients. So I'll ask, where do you see your career going? I don't know if that's even a good question to ask.
It's a great question. I ask it to myself very often as well.
That'll probably change multiple times, right?
Definitely. And that's one of the other things I love about the profession is how many different specialties there are. And with each one there comes a lot of learning and school and sometimes tests to pass to get into them and to really transition from one specialty to another. But if you want to and you get super bored in one, or you just are curious about another and want to go into it, you can. So I think that's the cool part of it. Originally, when I went to PT school, I definitely wanted to work with athletes, and I still love working with athletes. A lot of my clients and patients are runners right now, and they're training for races, and that's just something I really enjoy, working with people who are training for things. But in PT school, I also had a neuro rehab rotation, so it was mostly stroke and traumatic brain injury rehab. And I also fell in love with that. So I think neuro is just a whole nother ballgame. It's so interesting to me, and it's something I would like to gain more experience in and potentially go into. Maybe at a later date, I do see myself kind of in the outpatient setting for a little bit longer. And then amputees is another area that I really enjoyed. So I could see my career going a few different ways, if I'm being honest with you, so I don't have a perfect answer just yet. But definitely getting a lot of experience over the next few years before I really specialize or even think about opening a practice or anything like that. But I do plan on continuing to train on certain days in my free time as well. So that's something I also really enjoy. And it is a bit different than working as a PT. So it's nice to have a little combo.
Yeah. So if anyone's in the Chicago area and wants a badass trainer, good luck getting on Dr. Neri's schedule, but she'll always be training.
I love it.
I'm glad you love training because we wouldn't have met otherwise.
I know.
It's crazy. So actually, wait, a little side story. It's going to feel weird like telling you, more so telling people listening. So I've told you before, I actually found you on Instagram before I ever met you in person, just looking up mobility exercises. And you had this great segment of just 5 or 6 different stretches to open up your shoulders, which I know I needed to do. I even remember sending it to a few of my friends that I knew had shoulder problems. And then I met you because we trained together at a gym, and then went to follow you on Instagram and realized I was already following you. So you also have great Instagram content. Dang it, I don't think I can get through an episode without messing up vocabulary. I don't know. But since you have such great content on Instagram, where can people find you to see it for themselves, or even just to get a hold of you and say, hey?
Yeah, for sure. I love that story, by the way. We've talked about it a couple times now, and I think it's just like, it's so funny, and I feel like we were meant to end up at the same thing together.
Seriously.
My Instagram handle is Amanda, and then my last name, Neri, N as in November, E-R-I, PT. So it's just first name, last name, profession, essentially. And
at Amanda Neri PT.
Yes. And yeah, I try to keep up with posting little goodies here and there, mobility tips and tricks, and I've been posting a lot of strength training videos as well lately. So yeah, if you want to give it a follow, there are little goodies on there. You can always slide into my DMs. I do try to respond to everyone who asks me questions as well, if they have inquiries or they want to see something specific on Instagram. Obviously, Instagram doesn't show you everything, the whole picture about rehab or training, but it's nice to get little snippets here and there.
Learning things to try on your own, and if you have questions, ask you.
Yeah.
There are some gold nuggets in there because there are things that I've learned from you, different exercises that I make staples in my training. So
vice versa. By the way, everyone, Steph is a great trainer.
Oh, thank you. All right. Well, I guess any parting thoughts, or if there's one thing you want someone to take away after this conversation, what would it be?
I would say one takeaway would be, I guess, if you start to get into a program that you're not familiar with, or you do notice even just a minor ache or pain, it never hurts to consult someone who might have a great idea of what's going on with that. So if you have any questions, your PT is your friend. They can help you with your body ailments, especially if you're in a state where they're first contact. So just something to utilize. It's another tool in your kit as a person to use. So if you have any questions about it, definitely reach out, and I'm here to answer them. Yeah, it's been fun.
Even if those ailments are just a little bit of low back pain, a little bit of neck pain from sitting at your desk all day, which is probably 90% of America. So probably relevant to everyone listening.
Absolutely. We've all had it. We all probably will.
Right. Gosh, I know as I'm sitting here, I should probably have better posture as we're sitting here talking. But
yeah.
Awesome. Well, thank you so much. This was so interesting.
Of course. It was really fun.
Feeling inspired yet? We've got you covered. At the very end of the season, we'll be launching our OmniaFit website. You'll be able to access a platform filled with on-demand workouts like yoga, HIIT, Zumba, bar, and more from several amazing instructors. You'll also have access to meal prepping tips, personalized grocery lists, and dozens of recipes given the official okay by our incredible dietitian, Kate.
Along with everything Stephanie mentioned, you'll also have access to schedule appointments with some of the licensed professionals featured in this season. Email info@omniafit.co to stay updated on our November launch date. You'll want to stay tuned because our first season listeners get their first month free. Just use promo code POD2021, that's POD 2021 to redeem.